half of your testosterone level as a female is utilized by the age of 40. In men, just the same, by the age of 50, half of the testosterone is used. We're looking at ways that we can survive the times and the stresses that we're all in today. Being trained as a gynecologist, dealing with women for the past 20 some odd years, every day we hear as women mature in life, they start at around age 40 complaining of forgetfulness. They complain of weight gain around the middle section of their abdomen. They'll complain of decreased libido. What do we do for it? Well, in my experience, what I've encountered is patients will come in, they've been put on every antidepressant, every anti-anxiety, and we're putting a Band-Aid on a problem that really exists, and that problem is a decrease in hormone production. With the pellet therapy, it's like a revival. We have women that have not had hormones in their bodies for 20 years. All of a sudden, they reach a peak interest in sexual activity. That has triggered the whole onset of the men coming in, because we get the women feeling good. They're saying, hey, what about my husband? And that's when we incorporated bringing the men into the practice with the Sotopel pellet therapy. Women go through menopause. We never talk about the problem men go through, and it's called andropause. That's a male menopause. We can fix that now with the use of the hormone therapy. We have gentlemen that are 70 years old returning to activity they were doing when they were 50. When we place the pellet, we expect that within a very short time that you start feeling some differences. It may take 2 weeks, it may only be 24 hours where you will start seeing a sudden surge in your energy level, sleeping better, focus is better, overall general well-being is feeling better. It's interesting that the whole hormonal menopause that we've been dealing with for years and years, driven by the pharmaceutical industry using either pills or transdermal application with creams or patches. Today, what has come as a resurgence is the use of the hormone pellet. The benefit of the pellet over a pill, over a cream, a gel, or even a patch is that it is a constant release in the bloodstream. When you take a pill every day, you take that pill, your blood level goes up, it comes down, you take that pill again. When we utilize the pellet therapy, we're looking at a constant blood flow in the system. We're not looking for the up and down that we're going to get with the creams or the gels or the pills. So the pellet therapy is now foremost in my practice for treating menopause and andropause. When we utilize pellet therapy, it involves first getting blood work. We're looking at some baseline levels in your bloodstream. Consultation takes no more than 20 minutes. We talk about it, we've given you information about it. We will have them lay down, and just below the waistline, lying on your side, we will numb the area up. We'll make a tiny incision. The incision is so small we don't even need to stitch it closed, we put a bandage over it. The insertion is simple. We painlessly slip these tiny little pellets inside right underneath the skin. We tell them the first 48 hours to take it easy, don't overdo it, don't go work out in the gym or anything like that. But after that, they're pretty much free to do anything they want to do. That level will stay in their system. Women, the pellet will last 3 to 4 months. In gentlemen, the pellet will last probably up to 5 to 6 months. Everything we do here at Mirabile MD, Beauty, Health and Wellness, is looking at a person, the whole person, both men and women now. We're able to provide the weight management part of feeling good and looking good, the cosmetic enhancements that we can provide. The gynecologic care remains my base as my practice has continued to grow. With the addition of the hormone therapy and the manner that we're using it right now with both men and women, the whole goal is longevity. Optimal hormonal balance is what we're looking for to attain that goal. And there's no fountain of youth, but there are things we can do to look good, feel good, and survive the challenges that we all face every day getting older.